Meeting call to order.
I request President Rotarian PHF Ritika Gupta to confirm the minutes of the previous meeting.
The minutes of the previous meeting were circulated on our group for everyone's reference, and I believe everyone has gone through the same. Thereby, the minutes of the previous meeting stand confirmed.
Thank you so much, President. Good evening, everybody. Today, our topic is how to prevent kidney failure and avoid dialysis and kidney transplantation. And we have a very eminent doctor today with us, Dr. Chandan Chaudhari, MD, MED, DNB Nephrology, nephrologist and transplant physician, Wockhardt Hospital, Mumbai. Dr. Chandan Chaudhary is a senior nephrologist and renal transplant physician with over 15 years of experience at Wockhardt Hospital, Mumbai Central. He regularly performs both living donor and deceased donor kidney transplants, including complex ABO incompatible across blood group transplants. So I welcome Dr. Chandan Chaudhary, and we are glad to have you with us. And thank you for giving us your valuable time. Over to you, Dr. Chandan.
Hello, good evening, everyone. So, as we start waiting, whenever we start something new or auspicious, we always remember Shri Ganesha. Okay, so because the name of this club is Rotary Club of Organ Donation, so of course, organ donation is for organ transplantation. Okay, so when we imagine the Bhagwan Sri Ganesha, we see him as a Vakratunda Mahakaya, or sometimes we label it as a Lambodar Pitambar. So, Lambodar. Okay, so when we look at all our other gods, they are all fit and fine, but he is the only god who is little obese. So, and he is the only god who has been transplanted because he was transplanted with the head. Okay, so it just to make the discussion interesting, that the all the transplant patient, they receive the steroids, and the people who receive the steroid, they are the people who are obese. Okay, so just to correlate the things, that he is the only one who is obese, who has transplanted, and we don't know what was the science that point of time. Okay, so let's start our discussion. When we talk about prevention of kidney disease, or prevention for the dialysis, or prevention of a transplant, so what is most important is prevention of kidney disease, because if we prevent the kidney disease, of course we are not going to require a dialysis or a transplant. Now, when we talk about the kidney disease, the most important term now, even the medical science has changed for last 10 to 15 years, is that they have stopped using the term renal failure or chronic renal failure. They label the term as chronic kidney disease. Why? Because the kidney disease can have stages, which can be early stage kidney disease, it can be advanced stage kidney disease. So there can be CKD stage 1, stage 2, stage 3, stage 4, and stage 5. So why do we need to know this? Because when someone reaches to kidney stage 5, that is the time he is going to require a dialysis or transplant. So where we need to act when it is a stage 1, stage 2, stage 3, so that we can delay the onset of end stage kidney disease. Because now again someone will say, ki, why do we want to delay? Because if you are able to delay the end stage kidney disease or a CKD stage 5, as the CKD advances, the health or a morbidity also affects the patient's day-to-day life. Also, it increases his financial expenses. Okay, so definitely it helps him to keep healthy if we are able to halt him in an early stage of CKD. Now, when we again talk about the chronic kidney disease, sometime when we have to imagine our life cycle. So, life cycle, what do you mean by life cycle? Right from the baby when it is in the uterus of the mother. Okay, so there are some important histories, that if the mother had a PIH. So, what do you mean by PIH? PIH is a pregnancy induced hypertension or preeclampsia. Or if there's a some, in the layman language, they say the less water around the baby in the in the uterus. So these are the babies who may be having a kidney disease in the future. Then the second next term come is the preterm babies. So what do you mean by preterm babies? The babies who are born with the low birth weight. So there is a concept called as low nephron number. So what do you mean by this low nephron number? That, and why we are talking this, because the people, because every kidney is assumed to be having a 1 million nephrons. I'm sorry. Hello.
Yeah,
No,
please.
please go
Yeah,
ahead. Please go
yeah, yeah.
ahead.
So, so every kidney is assumed to have a 1 lakh of nephron in one kidney. So just imagine a baby who is born preterm or a low birth, he may not have that same number of nephrons. So, for imagination, if he has got, if he's born with just a 60,000 number of nephrons in each kidney, and then he grows, he gains the weight, he gains the muscle mass, he grows. Okay, and then the point comes when there is a per gram function of the kidney increases, and after age of 25, 30, he starts getting the blood pressure, he starts leaking the protein in the urine, and by 35 or 40 he may get the kidney disease, or some even may get the kidney disease or a kidney failure requiring dialysis at the age of 20 to 25 years also. So this is a very important concept, that if someone is preterm baby, someone is a low birth weight baby, these are the babies who may be at risk of developing the kidney disease in the future. So they should be monitored, or they should be given the advice. Monitored means just the monitoring of the creatinine and the urine routine. They are not costly test. Okay, then coming to mothers. Now what about the mothers? The all the females who develops the blood pressure during the pregnancy, they are at risk of developing the kidney disease in the future. So in simple words, what I try to explain my patient, that this pregnancy is like a stress test of your kidney. So if you develop the blood pressure, you have to understand that your kidney stress test is positive. So you be careful in the future that you may develop the kidney disease, you may have leakage of protein in the urine, you may have hypertension which is continued even beyond the beyond the delivery. Because why this is important, there are many females who comes to us in the age of 32, 35, 36, and then they say, yes, I had blood pressure, but then the baby was small, so I didn't care. Then everyone was behind the baby, so we didn't check the blood pressure, I was not having any symptoms. And then they realize ki the kidney disease has been advanced by now when it is getting diagnosed. So we have to start when our life cycle starts, the mother and the baby. Now when we talk about the babies, what we need to monitor, the babies who are having a delayed milestone. So what do you mean by delayed milestone? The delayed milestone means the baby who are not sitting at appropriate age, the babies who are not turning around in the bed at routine age. So these are the babies who may be having some abnormalities in the form of calcium phosphorus metabolism disorder. So what do you mean by this calcium phosphorus metabolism disorder? Means they may have the low calcium, low phosphorus or vitamin D deficiencies, and they do happen because of conditions known as renal tubular disorders. So renal tubular disorder means our kidney is not having just the function of making the urine and reducing the urea creatinine levels or controlling the urea creatinine levels. Our kidney is making hormone by the name erythropoietin, which is important hormone for red blood cells production. Our kidney is also for making a step in the vitamin D metabolism. What we say in sunlight we get is vitamin D2, but D2 D3 activation step happens in kidney. Okay, so sometimes even though the kidney function which is evaluated by the urea and creatinine levels, it may be normal, but the kidney's handling capacity of acid, handling capacity of calcium, phosphorus may be defective, and these are the babies who develop the bowing of the legs. So sometimes we see the babies who are having the legs like this, bowing legs, or the legs which are like this. Okay, so this is known as genu varum or genu valgum. So the babies who are developing these type of babies can be screened for the kidney disease, because we have seen few babies where they were even operated at early age, and then later on it was discovered that they were having actually a kidney disease or a renal tubular disorders, and which was not diagnosed. So so as the baby is growing, these are the some important points which we can monitor. Then the fever which is because of urinary tract infection in the sorry.
You can go ahead.
Yeah, yeah. So the fever which is because of urinary tract infection in kids is again a very important thing, because the urinary tract infection is something which is not common in kids. So if the male child, especially if a male child is developing a urinary tract infection, we need to screen him with this, at least a basic simple sonography. Why he got it? Because there are some conditions which if they are diagnosed early, you can prevent the end stage kidney disease or requiring them to reach to the stage of dialysis. Because there is a condition called as vesico-ureteric reflux, where where the urine is going back from the urine bag or the bladder towards the kidney, and this is known as reflux nephropathy. And if someone is having a reflux because of bladder problem or because of some wall or stricture or narrowing into the urinary tract, these are the babies, if they are intervened early, they may get definitely benefited. So that's why not neglecting the history of fever because of UTI. The fever, the babies do get fever because of viral fevers, pneumonias. That's fine. That's not fine, but that is okay. But that is treatable. But the something, the fever which is because of urinary tract infection, it should be digged into the detail why he has got the UTI. Because if we get the answer and if we can correct and rectify, we may be able to avoid the kidney failure. Okay. Now again, when the babies are growing more than years of 10 and years of 10 years, 12 years, what we need to see the height and height, whether they are gaining the proper height, whether they have any bony deformities. Because what do you mean by bony deformities? Yes, bony deformities can happen because of rickets, or what we call because of vitamin D deficiency. But there is a concept called as renal rickets. So renal is kidney and rickets is the rickets because of the kidney. So if they are having the bony deformities, if they are not gaining the weight, yes, we can have the simple evaluation by checking the urine routine. Are they losing the protein in urine? Whether their urea creatine levels are high or normal. Because it again gives us the idea whether they are developing and whether they are getting anything abnormal, and we can intervene early. Then there is an important concept in the toddler again, that if they see the blood in the urine. So if the blood in the urine is not always a kidney stone or infection, because there are two concepts. The one concept is known as synpharyngitic hematuria, means sometimes what happens, the babies are having sore throat and then they lose the blood in the urine. On the contrary, baby was having a fever 2 weeks back or 3 weeks back, and now he is having a cola colored urine. So these are the conditions where actually the filter of the kidney is getting affected, and these are the baby which need to be evaluated properly, rather than just saying, it may be because of UTI, it may be the dark urine, he may not have consumed the adequate water, or it may be just because of the stone and the sonography was normal, so we didn't evaluate it further. No, because these things do matter. So hematuria, UTI, these things may point us towards the early diagnosis of a kidney disease, and it may definitely help us. Okay. Now again, the baby is growing, the baby is growing, the boy or girl. So definitely, any addiction can be bad, because even if it is a smoking or any doping or anything, because all these things, they cause the early hypertension, and something which we definitely need to counsel avoiding, because these things are known to cause early hypertension. But the doping, I have at least seen 5 to 6 male patients who are in the age of 25 to 30, and they have lost the kidneys. And when we did the kidney biopsies, that what we can see on the kidney biopsy was the malignant hypertension. So malignant doesn't mean here the cancer, but the malignant hypertension means the blood pressure to such a high extent that it can cause the permanent damage to the organ. And then then we try to ask them, is there history, and then do you come to know, yes, there was a history of some drug abuse, and there was some history of the doping or something. So yes, these things definitely can work out if we counsel them for early stopping any habits. Because this blood pressure is something a very bad killer. So now we are turning towards a very important things which we commonly talk about, the blood pressure and diabetes as a killer of kidney disease. So what do we try to explain the patients in our day to day life, that kidney is like a filter. So if you will have a normal blood pressure or a controlled blood pressure, your filter will work for more years. If this filter will be forced with the high pressure, this filter will not work for many years, or it will get damaged. It will get damaged to its small pores, and this pores will become big, and you will start losing the protein in the urine, and you will start getting the swelling or the feet. So this blood pressure control is something which is very very important. And why do we need to understand that? We, as especially in India, we are having a many patients who are young hypertensives and who are young diabetics. So why this young hypertension and young diabetics is getting very important? Because if someone get diagnosed as having blood pressure at the age of 38 years, 40 years, 42 years of age, and you are expecting and you are having a life expectancy of just assume 80 years. So this man is going to live with diabetes or blood pressure for next 40 years. So after 10 years, 15 years, his organs are going to show the effect of diabetes or blood pressure on his organs. The organs are going to show the effect, and that is where the organ is going to we are going to lose the organ. So the organ can be brain, where they may have stroke, hypertensive retinopathy. It can be left ventricular hypertrophy or the stress on the heart, or it can be stress on the kidney. So that's why this early diagnosis of hypertension or blood pressure, we need to understand that it is not only the control of the blood pressure or the sugar is important, but these are the patients who should be screened very regularly whether there is any end organ damage. So what do you mean by end organ damage? End organ damage means the blood pressure or diabetes affecting retina, heart, or a urine. So what are the easy tests? So what we advise, we tell them to have a annual eye checkup so that they can check for the retinopathy. They can have an annual simple ECG. They can have an annual at least the urine check. Are they losing the protein in the urine? So these are the very easy, not very costly tests which may help to screen the start of kidney disease. Now, again, when we are talking about the young hypertension, what are the important things which we need to understand? That young hypertension many a times it revolves around the kidney. So, what do you mean by revolves? It revolves around the kidney. It means that the secondary hypertension or a young hypertension, most of the time the common cause is renal parenchymal disease. So what do you mean by renal parenchymal disease? Means something which is something bad or something abnormal with the kidneys. So if the kidneys are having scar, if the kidney filter is having some disease in the form of glomerulonephritis, these patient the person can get the blood pressure at young age, and it is the signal from the kidney in the form of blood pressure. So young hypertension, many times the three important things which we need to definitely evaluate, one is the renal parenchymal disease. The second is known as renovascular hypertension. So what do you mean by renovascular hypertension? So what we try to explain our patients in our day-to-day practice, that if you have a block in your brain artery, okay, you may get stroke, you may get numbness, you may get weakness. Okay, if you have block in your heart, the artery of the heart, you may have chest pain, you may have breathing difficulty. Okay, but if you have block in your artery of the kidney, block or narrowing of the artery of the kidney, what symptom you will have? You will not have any symptom. The only thing which may happen is the blood pressure and the rise in the creatinine. So unless you check the blood pressure or unless you check the creatinine, it will never come to know until the things have gone bad, or the blood pressure has increased to such an extent that it is causing the pressure on the heart or on the brain. So that's why the young hypertension, just doing a simple sonography helps us whether the kidney sizes are getting small. If the kidney sizes are getting small, we may suspect there may be there may be kidney disease, or there may be the problem with the renal arteries, especially if there is a disparity in the kidney size in a young person who has developed the blood pressure in the form of one kidney small and one kidney is large. Then we can suspect that the one kidney which is small may be having a less amount of the blood supply. So these are the very important things where we need to educate the people that these things we should not take lightly, because what we see in our day-to-day practice, that whenever you tell someone that you are hypertensive or you are a diabetic, the first thing they have is, no, off late I was having stress, no, off late I was having sweet food, so it may not be there, no, I may not be hypertensive, no, I may not be diabetic. So yes, you may not be diabetic or you may not be hypertensive, we accept it, but then you check yourself regularly. So if there is a blood pressure, take the medicine. It's not compulsion to take the medicine, or it's not that we want to prescribe you the medicine. What we want is that if you keep your blood pressure under control, it is going to help you in the long term, so that there won't be organ damage. Okay, so the same thing which we are talking about the blood pressure, is the similar thing, it happens in diabetics. Now coming to the diabetics as well as the blood pressure, there are few important medications which uh, there are available which help to slow down the further progress of diabetic kidney disease. So what we normally label them as ARBs or angiotensin receptor blockers, like some of you may be aware of it, telmisartan, losartan, these are the very famous medicines. Then there are medicines in the form of dapagliflozin, canagliflozin, empagliflozin, and then there are medicines like finrenin. So these are the medicines, they actually help to slow down the further progress of diabetic kidney disease. And I believe that this should be the mandatory in the prescription of a diabetic patients who are having the blood pressure or who are losing the protein in the urine, so that we can have less number of diabetic kidney disease patients. Because there are, because there is a term called as India is like a capital of diabetes, because we are having so many diabetics. So if you are having so many diabetics, if you are having so many young diabetics, so what is going to happen in the future? We may have so many diabetic kidney disease. So this is something very important. Then, as we are talking about the annual eye checkup, this annual eye checkup again become important for diabetics, especially a type 1 diabetics. It should be done right from the time of diagnosis. For type 2 diabetes or diabetes which is developed after age of 30, 40, or because of the obesity, we may have annual eye checkup after 5 years of diagnosis of diabetes. Now, why this is important? Apart, because this tells you, are you developing the retinopathy? So, if you are developing the retinopathy, there is a high probability that you are going to develop the diabetic kidney disease, because it's like, in a day-to-day language, day-to-day life, in a normal people language, we try to explain them. Retina is like your mirror of kidney. So that's why please have your retinopathy, because again we feel so bad. There are patients who come to us with the creatinine raised to the 5 or 6, and then they say, 2 years back I was undergoing the eye treatment for the retinopathy. I undergone a laser treatment. So I ask him whether have you checked the creatinine that time? No, no, no. It was little raised, just 1.8 or 2. It was mildly raised, so we didn't bother. We just took the eye treatment and continued our diabetic medications. So these patients, now we can't do anything, because as we cannot cure the diabetes, we cannot cure the hypertension, or we cannot reverse the time spent by kidney with the diabetes, then how can we reverse the diabetic kidney disease? So what is the best thing is? Best thing is the early diagnose and slowing the rate of loss of GFR. So what do you mean by this concept, rate of loss of GFR? So the kidney function is estimated on the basis of creatinine level, and that is known as GFR. So this GFR can be estimated by checking the creatinine, or one test is serum cystatin C, and it can be measured by the radioactive radionuclide scans in the form of DTPA scan. Now, when we are talking about this GFR, what we need to understand, after age of 40 years, even a normal healthy man who is non-diabetic, non-hypertensive may lose the GFR every year by some small fraction. And this is what we need to understand. So a person who get diagnosed as diabetic along with blood pressure, or a diabetic along with the protein in the urine, they lose the kidney function faster than a normal person. And definitely they lose the function sometime by the rate of 5 to 6 ml per minute per year. Now when we are talking about the GFR, what we need to understand, that if you check on the internet, what they write, the GFR of more than 120 is normal, 90 to 120, or it should be more than 90, and then our Indian patient gets scared, Arey, my GFR is 81 or 82, so it is low. No, what we need to understand, these GFR values are for the Western people who are more than 6 feet and having a daily high consumption of protein, especially animal origin. So we Indian who are having comparatively shorter stature and more of a plant-based diet or a vegetarian diet, for us the GFR of 80, 82 may be normal. So this is something which we need to understand, and there are studies which are done by the many institutes in the India, and they have proved that this GFR of average GFR of 80 to 82 may be normal for us. So we don't expect that our GFR should be 125 or 130 or 140. It may be normal for us. Again, what we need to understand, that as the age advances, you may have lower GFR, but which may be adequate and suitable for you. It is not necessary that it may be a kidney disease. Then again, when we are talking about this diabetes, and when I was talking about the retinopathy, so why this annual eye checkup helps us, that sometime imagine a situation that one guy who is a diabetic for 10 years, who was having retinopathy in the past, who's recently last 1 or 2 years is getting swelling over the feet, and now his creatinine has increased to 1.5, 2 or 2.2. Normally, the creatinine values are below 1.4. The creatinine is a type of molecule which is present in everyone's body, and high creatinine value denotes there is some problem with the kidney function. So, and the other man who has got the diabetes just for 2 years and has consumed the painkiller for his severe backache or something for 2 months, and he's also having a rise in the creatinine. So what is the difference we need to understand? The first guy is having a typical diabetic kidney disease, who was having a retina problem, who was having a many years of diabetes, who was losing the protein in the urine. But on the contrary, the other guy has just consumed the painkiller medication and his diabetes is just of a short duration. So this guy is having a likely a non-diabetic kidney disease. And this is very important. Why? Because this is something which is can be stopped, it can be reversed, or it can be avoided. And that's why a diabetic patient, we need to educate them that avoid painkillers just taking like that, or if you need to take painkillers very regularly by meeting your orthopedic doctor, try to treat the cause rather than pain. This is a very important statement, because there are people who are taking the painkillers for years and years for their joint pain, for their back pain, and but they want to avoid the surgery. So if you are otherwise fit to go for a surgery, please correct the problem, please rectify the problem rather than delaying it with the painkillers. Because once your creatinine increases or your kidneys start becoming weak, this same surgery may give more complication in peri-surgical time or a peri-operative time. And again, what we need to understand, with the time, everyone's age is going to increase. We are going to get older and older. So, if today you are operated and your recovery may be faster compared to the after 5 years, if you'll get operated when you are not able to walk, and that time you are expecting that you should have a faster recovery, it may not happen. So that's why sometimes we have to take a decision in a balanced way, that rather than just consuming the painkiller, we have to treat the cause rather than just treating a symptom. Then again, one more suggestion which I personally give to my patient is that avoiding the loose medication. So now this you may find little controversial topic, but the loose medication means sometimes they just come to us and say, okay, I was having fever for 2 days. I went down to my regular doctor. He gave me in one pocket the two blue medicine, two green medicine, two yellow tablets, and he asked me to consume it. So I always tell them, once you are diagnosed as kidney disease or your creatinine is showing high values or you're losing protein in urine, please stop taking this. You request your doctor to write a proper prescription for you, and you buy it from the medical store, so that at least you are aware that what are you consuming. Now, why it helps me? Because many times we keep on scratching our head, why my patient's creatinine last visit was normal or last visit was low and this visit is an increase. And and it again gives the stress to the family and patient as well, that what is going bad, why the things are going bad with my kidneys. That's why this is something which we always try to guide them, that please avoid the loose medication, please avoid over the counter painkiller medication, please avoid just daily consumption of the pain. Okay, then coming to the very important point is obesity. So why this obesity is important? If you are not diabetic, you are not hypertensive, but you are obese, you are not developed the blood pressure, you are not developed the diabetes, but you are obese. So why this obesity matters? Again, we have to go back to the concept of that nephron number. Now here the nephron number is not affected. Here the nephron number is not changed, but what is happening, because you are getting obese, the per gram function of the kidney is more. So in very simple words, to explain you, that if you are 80 kgs and your kidneys are just 600 grams, on the contrary, when now you're 120 kg and kidneys are still 600 grams. So these kidneys will have a more urea, more load compared to the previous. So that's why the obese people are again at risk of developing the kidney disease. So obesity is itself an independent risk factor for a kidney disease. So what are the advice? Reducing the weight by at least 5 to 7 kgs, 5 to 8 kgs helps the patient to reduce the protein in the urine, to reduce to help the stabilizing their creatinine values and keeping them more healthy. Now, this urine protein, which is something I'm continuously talking. Why this is important? Because initially the kidney disease was staged on the basis of GFR values. Now the kidney disease is staged on the basis of presence of protein in the urine, and then the decrease in the function of the kidney in the form of low GFR. So even if someone is losing the protein in the urine and his kidney functions are normal in the form of urea creatinine levels, they are still considered as at risk of developing the kidney disease. So protein in urine is not just the infection. That is something which we need to understand, and that is the right time to act to prevent the onset of kidney disease, because this is something which is definitely going, and these medicines are not costly medicines. These are quite easily available and cheap medicines. Cheap means they are not expensive medicines, but they help us to control the protein in the urine. So sometimes just the selection of blood pressure medication, because many times we see the person comes at the 45 years of age and he says I am diabetic for I am hypertensive for 4 years and I am consuming tablet amlodipine. Now, this amlodipine tablet is not a bad tablet, it's a very good tablet. We also use it. But sometimes this young hypertensive, if they are giving a if they are given a tablet something like telmisartan, losartan, olmesartan, they may help the kidneys to run for many years compared to this. There is a concept called as renoprotection or a nephroprotection. So choosing a right blood pressure medication at start, choosing a right diabetic medication at start is very important in prevention of a kidney disease. So I think it's 8:30. So we may start for question and answer, and if there are any queries, I will again answer them.
Thank you very much, Dr. Chaudhary, for giving such a enlightenment to all of us and the viewers who are watching live or who are going to watch this program afterwards, because it's on the YouTube live, about how to prevent kidney failure and avoid dialysis and kidney transplantation. Now, before I will open the questions to everyone, my first question to you is, can an enlarged prostate lead to kidney damage or chronic kidney disease if left untreated?
Yes, sir. I will tell you, the maximum creatinine value I have seen in a patient with the prostate was 22 milligrams. So normal creatinine is 1, and this man came with the altered sensorium. And then when we just put the Foley's catheter, next day his creatinine became 10, and on third day it became less than 2. So this man was having a prostate problem which was slowly growing, and then initially he was putting the pressure, then later on he started putting pressure on the abdomen, and then the urine was remaining back and it was going backwards towards the kidney. So having just a enlarged prostate will not give you the kidney problem, but if it is enlarged prostate causing the bladder not to empty completely and giving the back pressure till the kidney, it can give to the kidney disease.
Okay, thank you very much. And the second question, before I will open it, what about the latest medicines or injections like Manjaro or Ozempic, etc., whether they are helpful for the kidney diseases or not?
Yes, sir. They have been shown in almost all the studies. They have been shown to be useful for the kidney disease. But what I will always say, that this checklist of a diabetic patient, the correction of the blood pressure with the right medicine to control the protein in urine, in the form of medicines like telmisartan, losartan, or dapagliflozin, they are the basic foundation of the treatment. And despite this, if despite this patient is progressing or is a obese patient, then we can add this new or fancy or costly medications. So they are good, they are not bad, but they cannot be the first line medicine. So what is the important time tested medicine and non costly medicine? They should be first added, and then we should add them. They are very good medicine, there is no doubt about it.
Okay, thank you very much. Now I'm opening this thing, and first question which I'm going to take is from our one of the Rotarian who is based in California. He himself is a kidney recipient, Rotarian Sunil Gupta. Please ask your question.
Yeah, good morning from California. Dr.
Hello.
Chaudhary was a very enlightening talk. Question for just lifestyle. By the way, really appreciated how you walked everybody through right from childhood and what we can be, what causes all of these issues with the kidney. Of course, my history was different, was a polycystic kidney case. But the question that I want to pose to you is this increasing debate about Indians not getting enough protein in diet. Can you give us your insight on how much protein is proper for a kidney diet, and if somebody like me who lives on a transplanted kidney with one kidney, how much protein should I be taking?
So it's a very good question, because many times what happens, that first we'll answer the question in the scientific way, that the protein recommendation for a normal person with the normal kidney function is 1 gram per kg per day is something which is recommended. Okay, the person who has got the low kidney function in the form of low GFR, the protein intake is considered advised to be on the lower side, like 0.6 to 0.8 grams per kg per day. Now, what happens in our Indian setup, as you are rightly asking the question, that we see patients who are having creatinine of 3 or 3.5, and they are pure vegetarian patients, and then they stop eating the protein. So we many times in Indian patients, if they are vegetarians, we tell them do not restrict the vegetarian protein, because what you are saying is correct, because the many times they are not getting the adequate protein. And on the contrary, because my creatinine will get high, they stop eating dal, they stop taking milk, and then they end up with some infections or pneumonia. Then they are on the ventilator for 1 or 2 weeks. So definitely we are low into the protein in the diet. Okay, so we should have adequate protein in the diet. The second thing, the recommendation is 1 gram per kg per day. So if you are a transplant patient with the normal kidney function, you will be allowed to have a liberal protein intake in the form of 1 gram. But if your renal function is on the lower side, if your creatinine is on the higher side, if your GFR is on the lower side, you may be recommended the lower protein intake. Again, what we need to see is your blood pressure and the proteinuria. Then what I would like to add here is that for dialysis patients, it should be more and more protein than even a normal people, because this is the mistake which is done by almost 60 to 70% of the dialysis patients in India, that if you ask them, are you taking high good protein? For example, if someone is a non-vegetarian, and if you ask him, are you taking non-vegetarian nowadays? So he says, no, my creatine will rise. So we always try to explain them, you are on dialysis, the kidneys are fired, so please take protein, because the recommended protein intake is 1.2 gram per kg per day for dialysis patient. So yes, what you are saying is correct.
Okay, thank you very much. Now I have received a message from Rotarian Manjeet. She's having some problem with the video, but she wants to ask a question. Are you there, Rotarian Manjeet?
Yes, I'm there.
Yeah, please ask the question.
First of all, thank you very much, doctor. Your information was very enlightening. I have been operated on my kidney for renal cell carcinoma about 19 years back.
Okay, madam.
My right kidney has been removed. I am otherwise healthy. I'm 67 years old.
Okay.
And but I only want to know what are the tests which I should be doing regularly. And number two, what should be my water intake? And how much should my creatine level be at all times?
So, madam, the first thing, if your creatinine levels, it should be what we expect, it should be below 1.4. Okay.
Okay.
So even if they are more than that, you should have a regular follow-up with the nephrologist, and he may help you to slow down the rate of loss of kidney disease. Okay. So the first important thing is a very easy test which can be done is urine routine. So what we need to understand, when we are asking someone to go for a live transplant, and one person is going to donate his one kidney to the other person, so we are explaining him to that your 50% of the kidney function will be removed. So if his total kidney function is normal, then only you advise someone to go for a donation for a kidney transplant. So in your case, just assume that you have donated the kidney and your other kidney is normal. So if your other kidney is normal, you don't need to worry. Okay. So what are the important things which you should watch for? You should watch for an onset of blood pressure. If your blood pressure is high, you should keep it under control. Okay. The second thing is you should check your creatinine once in 3 months, and your urine protein once in 3 months. If there is a protein in the urine, you may check it little early, because the earlier stage will be the protein in the urine, and then the rise in the creatinine. So that's
Okay.
because, and why this happens, because in case you are going to develop the problem with the other kidney, so there will be the hyperfiltration injury. So hyperfiltration injury means now the one kidney is doing the work of the two kidneys. Okay.
Right.
And that's why you are going to monitor is the protein in the urine. The third
Okay.
thing is the annual sonography, because some renal cell carcinoma may have, if they are because of some gene mutations, may have a bilateral appearance. So definitely you are going to watch for an annual sonography whether you are developing any new mass or any lesion or any abnormal lesion on the kidneys. Okay.
Right.
Coming to the water intake, if you are not losing protein in the urine and if your blood pressure is well controlled, if you are not getting swelling over the feet, you can have at least a 2.5 to 3 liters of water intake, no problem. But in case you are losing the protein in the urine or you are getting swelling over the feet, then it should be an individualized decision with the nephrology consultation, madam.
Okay. Thank you. You have
Thank you
answered
very
my
much,
questions.
Rotarian Manjeet, for
Thank
asking
you.
questions. I have seen the hand raised of our Inspire President, Rotarian PHF Ritika Gupta. Yes, please ask the question.
Thank you very much, Dr. Chaudhary, for your valuable inputs on kidney health. I just wanted to inquire that I mean, so many women tend to hold their pee because we don't have access to washrooms very easily. So is holding your pee also, does it affect kidney health and anything like that?
No, madam. It will not affect the kidney health unless someone has got a neurogenic bladder or a large bladder and which is causing the back pressure till the kidneys. Okay. So here, because you have asked this a very important question, I will like to say something apart from this holding the pee, that urinary tract infection. Okay. It is of two types. It can be lower UTI. It can be upper UTI. So the infection above the bladder, above the urinary bag, is upper UTI, and lower the bladder, the infection of the bladder or urinary tract, it can be lower UTI. Now there are many females, especially in the postmenopausal age, who are having pelvic floor weakness, okay, who may have dryness of the mucosa causing the stricture, means the narrowing of the urinary tract, and they have urgency or they have pain while passing the urine, and they assume that they are having UTI, and then they keep on taking the antibiotic. So what we need to understand, that it is not necessary that you need to take the antibiotic in such cases. If they are having the cystocele, if they are having a prolapse, pelvic floor muscle weakness, and it should be addressed early. Okay. So this holding the urine for a long time may not create the problem unless you are having a bladder which is weak or enlarged bladder. There are conditions like neurogenic bladder. So otherwise, no.
Okay. All
Thank
right.
you very
Thank
much.
you. And kidney stones do happen, but right?
Holding the urine in the bladder will not cause the kidney stones.
Either. Okay. Thank you very
Okay,
much.
because it is the urine which is already made by the kidney, has come from kidney into the pipe into the bladder. So holding it will not cause the kidney stone.
Okay. Thank you very much.
Thank you very much. I can see Rotarian Ramnath Pradeep. You have any question, Rotarian Ramnath Pradeep? Please
Yeah,
ask.
Dr. Sir. I have heard about you for the 30 minutes. I'm really very happy and complimenting to you. You have given so much time for us. Now, at this stage of us, now when I have undergone all the tests, and the doctor, physician, as well as my, the dietitian, he has also advised that you don't have any problem at this level. But at the same time, the diabetic medicine which was being given has lowered down. Instead of a higher power, it has been lowered down. Now, how long it can be? I have been talking to him. Of course, I am talking to him. But how long it can continue? Because 6 months or 3 months or 4 months, because I generally go about 6 months to 1 year entire test. But when doctor says, and all other doctors in the group, when they have seen the report, they say that you don't have any problem.
So you
So
can
mental problem comes. I don't have a problem, but I do have a walking problem sometime. I do have a urine, problem, holding problem. Yeah, this type of things keeps on coming. So how do we address these issues?
So sir, if
And third question, sir, and whether the kidney disease when identified in initial stage, whether it can be prevented by exercise or by taking only medicine.
Okay. So the
Because
first question,
what I find is that you keep on taking the medicine, in impact somewhere it get impacted.
okay.
So whether along with the medicine, lower dose medicine, and along with the exercise, can it prevent from further damage?
Okay. So, sir, the first question is, if you are doing very well, okay, with the well-controlled blood pressure, there is the renal function tests are normal, then and your physician has advised to see once in 6 months, it's fine. Okay. The second question is, many times what we try to tell the patient that having a problem in passing urine, slow flow, or not able to completely empty the bladder, not necessarily it is a kidney disease. Okay, because these things can happen because of the bladder issues, they can happen because of the prostate issues. So we need to see whether there is a back pressure till the kidney in the form of sonography is labeled as hydronephrosis. Okay, so if it is not there, so these lower urinary tract symptoms may be related to prostate. Coming to the third point of exercise. So as I said, the if someone is overweight, exercise may help them. Okay. Okay, and again, if someone is doing a exercise, they say by the endorphins is the chemical which is secreted, so they also work as an antidepressant, then they also work as a well-being for the body. Okay, so it is not that the exercise is only going to help, it depends on the severity of the problem. It depends on the severity of the problem, cause of the kidney disease. So what I mean, like, we are just focusing here on the diabetes, hypertension, and all these issues, but there are some conditions where patients are having a condition named by the glomerulonephritis. So when patient get diagnosed as having a high creatinine suddenly, or protein in the urine, he's a non-diabetic guy, non-hypertensive guy, in such patient we need a biopsy of the kidney also, because if we do the biopsy of the kidney, we know what type of disease, and then accordingly we can treat. So doing exercise, yoga will definitely help, they are not wrong. Okay, but it depends on the cause of a kidney disease, because all medicine may not suit the one problem. So we cannot say that the only exercise and yoga will help, or only medicine will help. Definitely there is a contribution of diet and lifestyle modification also.
Thank you, doctor.
Thank you very much. Before I will go to another question, Rotarian Manjeet again asked, what about the ESR? Her ESR is 25. Whether it will also affect the kidney health?
No, sir. The ESR is usually the marker of inflammation, and ESR is more of a non-specific marker. So high ESR, we cannot just point out to the kidney disease or presence of diabetes. It just tells us that there may be something abnormal, but high ESR is can be high only in the rare condition of multiple myeloma. Otherwise, high ESR doesn't mean that there should be kidney disease always.
Okay, thank you very much. Now, whosoever wants to ask the question, please unmute or raise your hand, so I will immediately take you. I just request one plus one our member or invitee using the phone number as 1+. We cannot identify. If you are a member, we cannot give you the attendance. So please write down your name on the screen so that we know that who are you. That will be easier for us. Anyway, thank you very much. Now, again, I can see Rotarian Sunil Gupta has raised his question, hand. Yes, please go ahead.
Yes, I'm really enjoying our talk this morning, this evening. And I'd like to ask another follow-on question about reversing kidney disease. You talked about the different stages from 1, 2, 3, 4, 5. There is a lot of research now being done about trying to reverse the stages. And if that is possible, at least where I reside here in the United States, because most of the time when you go for checkups, the traditional concept has been that the kidneys are born with 1 million nephrons, and if they start decaying or aging or scarring, they never recover. So what are your insights on that?
Yes, sir. It's a very good question. As in the last question, I was answering that doing a biopsy of the kidney. Because sometimes we see the patient who is non-diabetic, non-hypertensive patient, and he comes up with the creatinine sometimes 8, 9, 10, and then they even require 1 or 2 sessions of dialysis. Then we assess the kidney size. If the kidney sizes are normal and he's a non-diabetic guy, we do the biopsy. We see how much is the temporary damage and how much is the permanent damage. Or in the medical terms, they say how much is the activity of a disease and how much is the chronicity of the disease. So if there is activity more and no permanent or chronic damage, then these are the patient, if treated properly, they recover and we are able to stop dialysis. So one of my patient who has recovered from the creatinine of even 30, who came to me from the Uttar Pradesh with the hemoglobin of 4 and creatine of 30, and we are able to stop his dialysis. So the first thing is the right diagnosis of a kidney disease. That what is the cause of kidney disease? This is very important, because if you are able to diagnose the cause of kidney disease and how much permanent damage it has caused and whether it has just caused a temporary damage, it may be reversible. Then if we are, because if we don't know the cause, we cannot just say that all the kidney disease in a blanket way that they are irreversible or they are reversible, because it depends on the cause. And at the same time, nowadays the genetics has evolved too much that even in India we are very routinely doing the genetic test, and there are some people who are having a genetic cause of a kidney disease. So these type of a patient, if they are having a genetic nephrotic syndrome, even if you bombard them with the steroid, they don't reverse. Okay, so yes, if there is a gene mutation which has caused the disease, it may not be reversible. On the contrary, they are talking about the reversing the kidney disease. It matters. The research is in very early stage, like what they have found out. If someone is a diabetic donor, if someone is a cadaver who is diabetic with very early diabetic changes in the microscopy of a kidney, and this kidney is transplanted to a non-diabetic guy, and they have seen the reversal of the diabetic kidney disease. So these things are in very primitive stage. We cannot right now say that the diabetic kidney disease or a hypertensive kidney disease may be reversible, but if there are other causes, it may be reversible, and it depends on the duration of a kidney disease.
Okay, thank you very much. Before I will move to another question, my question to you is, what about energy drink? It's very common. Everyone is going to the gym nowadays and then consuming the energy drink, or so much advertisements are coming. Do you think the energy drinks are good for kidney health, or they are harmful for the kidney health?
So the first thing I will tell you, before we talk about the energy drink, I will tell you something. There is a condition with which we see a patient at least once a year is rhabdomyolysis. So what is rhabdomyolysis? Recently I had one patient who went to a pilgrimage site, and he went almost some 10,000 steps without water and without food. And when he came down, after 2 days, he was having severe body pain. So he thought it is because of exertion. So he started consuming the painkillers. And on third to fourth day, his urine output was completely zero. And when we checked, his creatinine went to high. Now, this condition was a muscle breakage because of the excessive muscular activity without hydration. So what I'm trying to tell you, that when someone is doing a heavy gym, the first thing they should do is a hydration, because what is not happening is the adequate hydration. Because if they adequately hydrate, then we'll talk about the energy drink. Because even if someone is not consuming the energy drink and he's doing the heavy exercises, taking a high protein diet, his uric acid levels are going high, and he's not hydrating himself, he can develop a kidney disease. So this is the first thing, and then there is an add-on energy drink. Now what this energy drink, because what exactly it contains, it also matters. Okay, then are we taking the more protein than desired, and are we getting a high uric acid levels, are we seeing the uric acid crystals in the urine? So these are the things we need to monitor. So I cannot say that blindly everyone should take an energy drink. Now energy drink can be again a different type. It can be simple protein supplement. There are some people who are taking the creatinine, and some people who are taking the something like Red Bull also. Okay, so if it is an energy drink, we just causing you to cause the give you the kick. So this is something which may create a bad problem, because it may raise your blood pressure. Okay, so my suggestion is, you should be following with some doctor. You should have your basic blood test, blood pressure, and then consume it under supervision rather than just blindly consuming it.
Okay, thank you very much. Whosoever wants to ask question, please unmute. Now, one more thing, there was a survey done recently by the Economic Times in Bangalore, and they found that more than 20% of the youth up to the age of 35 are facing the organs failure. Even liver or the kidney, may not, these are the, what is the reason and why? It's in the Bangalore where the IT and the banking sector, basically those who are working overnight, whole night and the lifestyle. What you say about that, how to prevent, because it's a very alarming situation when the youth are going to face these types of things.
Sir, I will just say that what we are eating is very bad. Okay, because what has been told by our ancestors to eat, we have stopped that and we are assuming the diet, Western diet on an Indian body. We are basically trying the Western diet on the Indian body. Okay, this is what I will say in a very simple words to understand. Okay, because the good antioxidant content of the food in the form of fruits or vegetable, the protein content of the food has gone down and it's more of a processed food which has come in. Okay, then the second thing is the stress. Okay, because I just last week I saw one resident doctor who was working in the hospital. He did his night duty and then he went to gym. So I said, why you are going to gym? Because after night you should take rest. And you must have seen in last 2 3 years that there are multiple cities that the doctor has collapsed in the gym and he was having a massive heart attack. So the first thing is the stress, not taking the adequate rest. Okay, and then this is processed food, fast food. So something I will say this is something which is killing us. Okay, and of course the mental stress is something which is very bad because whenever we say someone is going to develop the blood pressure, there's a concept called as loss of nocturnal deep. So what do you mean by loss of nocturnal deep? Our average blood pressure in the day, if it is 130, our average night blood pressure should be 110. So we should be relaxed in our sleep that much. Now, if you see what you are talking about, that this the if you take the 100 youth, how many of them may be sleeping without mobile, looking for last 30 minutes of sleep or 45 minutes of the sleep? Okay, now and what they are actually watching? Of course, they are watching something on the Netflix, which is because something which is going to keep them engaged on that. Okay, and then do you expect that they may be actually having a good quality of the sleep? And then again in the daytime, the insecurities, competition, stress, and then there is a concept called as stress eating. So stress eating again, the unless you eat something which satisfies your mind, you are going to eat the food which satisfies your mind rather than which satisfies your tummy. So I think these are the things where we need to work, and we can't have just one or two points where which will help us to prevent these things. So these are the lifestyle modification is very important, sir.
Okay, thank you very much, doctor. Is there any question left from any one of you? Yes, please ask. Unmute yourself.
I know we are going to be over time, but I'll ask a very quick question. And it's about some healthy supplements that all of us should be consuming just to be preventative. Things like turmeric and all. Would you recommend any of these supplements for healthy kidney functions?
Sir, I will tell you, I don't recommend any supplements unless it is prescribed by doctor. Because I will tell you that we see at least a one case of high calcium every month. Because the moment you get the back pain, the moment you get the joint pain, someone comes in the family, take calcium, take vitamin D. And we are seeing that patient coming with the hypervitaminosis D or hypercalcemia. Even right now, I have one patient admitted with the calcium 15 in the ward. So there are people who are coming with the hypercalcemia and hypervitaminosis D, and it has such an unusual presentation. It may be irritability, constipation, okay, or on the routine evaluation, creatinine was raised. So it doesn't get diagnosed early. Okay. So I will suggest the supplement should be something which is prescribed by the doctor after looking at the report, or if he feels it need to be added, rather than just taking it blindly. And there is no such supplement which will help the kidney to keep healthy. Okay. So yes, what there is a very good diagram if you put it in the diet for a kidney disease in the Google. So what they have given, that the half of your plate should be the natural food in the form of fruit and vegetable, 1/4 should be the carbs, and 1/4 should be the protein. Okay. So this is the, if you put it in the Google, you will see that image. It is given in the KDIGO guidelines, Kidney Disease Initiative and Global Outcome Guidelines, Kidney Disease, KDIGO guidelines for the kidney disease. You can, it is easily downloadable.
Okay, thank you very much. I think I am going to take the last question. Rotarian Sheldon Mercy has asked, are you there? Please unmute and switch on your video, Rotarian Sheldon Mercy. Okay, I think some problem with her.
Hello, hello, sir. Can you audible, sir?
Yeah.
Audible. What about your video?
Sir, I have some network issues. That's
Okay,
why.
okay, please go ahead.
Sir, I need a one question from you, sir. Could you please suggest me for what is a good, how to maintain a very good kidney for a healthy lifestyle? Because nowadays is so many of for a kid, everybody is suffering for a fatty liver or whatever it may happen. Will you suggest any good forms of to maintain a very good
The
diet,
first
sir?
thing I will suggest is to avoid being overweight. The second is, after certain age, especially after 25 years, 30 years, initially we're telling this for the 40 years, but checking a blood pressure at least once a year, once in 6 months, because onset of hypertension can be the early telltale sign of maybe possibility of the kidney disease. Okay, checking blood pressures, checking the sugars at least once a year. Okay, avoiding the excessive painkiller use. The once or twice a month for headache or back pain or something is fine. So avoiding the painkillers, good hydration. These are the things which I can tell you.
Okay, sir. Okay, sir. Thank you, sir. Thank you for your
Thank
suggestion.
you very much. I think the question was over. Over to you, Inspire Secretary.
Thank you so much, Dr. Chandan Chaudhary, for a beautiful technical explanation and answering our questions so patiently. I request Rotarian Sunil Gupta from California to please give the vote of thanks.
It's my pleasure. On behalf of all of us at Rotary Club of Organ Donor Awareness, I would like to express our heartfelt gratitude to you, Dr. Chandan Chaudhary. You know, you have given us a very enlightening and highly informative talk on prevention and stages of the kidney disease. And it has helped us understand better the importance of early detection, timely intervention, and adopting a healthy lifestyle to protect kidney health. Again, your dedication to this field and spreading awareness has been truly inspiring. And I'm confident that the knowledge you shared today will encourage not only all of us to become more proactive about our own health, but also spread the word and this important message to our families and communities. Once again, thank you, Dr. Chaudhary, from bottom of my heart and from all of us for your valuable time, wisdom, and commitment to improving lives of people on this globe. Deeply grateful for your presence and your contribution today.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you, Rotarian Sunil Gupta, for the vote of thanks. And thank you, Dr. Chandan Chaudhary. And thank you all Rotarians for attending this meeting. Over to you, President.
Thank you very much to our chief guest, speaker for the day. Thank you very much, everyone, for attending the session. And I would now like to adjourn the meeting. So thank you very much. Good night.